My name is Christina Henry. I am talking to you today about how impactful chiropractic care is and how really it should be covered by insurance. A little bit about my story with chiropractic care. I was about 4 months pregnant with a really big baby. I couldn't walk, I couldn't move. I had so much pain in my low back going down to my legs, and my mom's like, you know what, I don't care, you're gonna go. And she took me in, and I was so scared because in my mind, it was one wrong pop, that's all it took. And the chiropractor that I went to, he was really good with me. He practiced in prenatal adjustments and manipulation. And I left there able to walk and completely pain-free. That really changed my life from that point forward. For the longest time, I would not let him do manually adjust my neck because I was just too scared of it. Until recently, when I started working with a different type of chiropractor. I started working with him about 5 months ago or so. And he specializes in what's called biophysics. So he uses kinesiology to help with spinal correction and manipulation. And it's one big broad certification that he has. And he performed an adjustment on me, and I allowed him to do my neck, and he walked me through it. He took his time and provided that quality, compassionate care that was lacking with my other chiropractor. He adjusted my neck manually, my whole body, my hands, my fingers, everything. And from that point forward, I had this whole different type of energy. I felt good. I didn't feel sore like, oh, that adjustment felt good, but my back is stiff, my muscles are like traumatized. And that's what's different about specifically this type of chiropractor that I work for, and the whole reason behind why I decided to do this paper. I recall several patients. One patient had chemotherapy. She was a cancer patient, and she was a professional dancer, loved to dance, loved to teach it. And because of all of the cancer treatments that she had to go through, it really gave her neuropathy really bad to where she couldn't walk. She was always in pain. And after starting with this program that we have here with my work, she's able to dance, to walk, to teach, professionally dance again, and have no pain. And so that's really, patients telling me that they were told that they had to have surgery. That was the only option, and they couldn't afford it because they had to take time off work. And they do these sets of treatments with decompression, and they're pain-free. We figured out the root of the problem, and we got rid of it. The other thing that chiropractors really can help with is the medication piece of it. So chiropractors don't prescribe medication. They don't. And we have this opioid narcotic problem in the United States. And a lot of it is prescribed due to chronic pain. And if we, instead of just putting a Band-Aid on the problem or masking the problem, we could actually solve the problem and take these medications off the streets because patients don't need them. There's a study, 3,464 patients were surveyed. 39% noted seeing a chiropractor due to insufficient relief of their symptoms. 68% of those had back pain, 50% neck pain, 38% hip, and 32% shoulder pain. Now, what just is a chiropractor? They perform and treat neuromuscular skeletal conditions such as herniated discs, scoliosis, sciatica, headaches, migraines, vertigo, various pains, like I said, the neck, back, shoulder, knees. They do treat for accidents, whether it be a car accident or a workers' comp problem. And the thing is that they go through the same schooling that doctors do, the same amount of time. It's just about the same amount of money. So why is this not being covered by insurance? That's the real root of this problem. Like I mentioned before, my chiropractor that I work for is certified in biophysics. Well, there's other certifications that they can hold, such as acupuncture, internists, forensics, neurology, nutrition, pediatrics, rehab, and sports medicine. Now, in a moment, I am going to take you on a tour and show you the different tools that we use and how we use them. Back pain and neck pain are the leading reason for doctor visits. And the treatments that they prescribe are medication, or physical therapy, or refer to another specialist who wants to do surgeries or injections. And what does that all cost? You know, patients have to take time off work. Patients are prescribed narcotics. Patients are in an intense amount of pain, and we do or don't know if it's actually going to solve the problem. The chiropractor's approach is where they really look to narrow down what the root of the problem is. What can we fix? And how can we allow the body to heal itself? Now, some people say, well, how can a body heal itself? Well, take a broken bone, for example. You put a cast on, the cast is the tool to help the body heal itself. Or stitches, when someone cuts their hand. The stitches act as a tool for the body to heal itself. And chiropractors really hone into the holistic approach where we can heal within. As I noted before, some of the conditions that chiropractors can treat, like back pain, that's a really, really big chronic condition that is seen very frequently in traditional medicine. And a lot of times, some of the back pain is caused by something that can be fixed, like spinal stenosis, which is the narrowing of the spine, scoliosis, which is abnormal curvature of the spine, sciatica. Sciatica is pinched nerves, and that could be caused by a herniated disc. And again, all of these treatments in traditional medicine refer to medicine, therapies, and injections, or even surgeries. When we take a different approach, allowing the body to, within treatments like decompression, it allows the body to, you know, when you have a herniated disc, well, the decompression pulls and allows the body to go into the natural form that it has. There's traction therapy. Traction therapy is a spinal correction. So if there's curves in the spine, whether it go left, right, up and down, really weird angles, traction therapy can really help that. And I'll show you those tools here shortly. The herniated disc specifically is the cushion that protrudes the vertebrae, causing the pinched nerve. So there's a cushion in between your vertebrae, and when that pushes out, that causes a pinched nerve and causes the pain. It's the second leading cause of doctor visits, hospital stays, both prescription and non-prescription drugs, as well as the most prevalent chronic medical problem and cause of long-term disability. For surgeries, some may have discectomies where they actually remove the disc or the cushion and put something else in there, or spinal fusions where they just fuse the spine together. Again, these all have invasive procedures, and these costing hundreds and thousands of dollars, tens of thousands of dollars, and yet we can do the same thing for a lot less and not have to have patients take time off work. They just have to come in for appointments. Another condition that I wanted to speak about today is neuropathy. Neuropathy is damage of nerves, and it can be caused by various things, like chemical treatments like chemotherapy or radiation, diabetes, chronic inflammation, idiopathic, which means we don't know what's causing it, and even medications. Did you know gabapentin is a medication that is prescribed for neuropathy? But actually it's not approved to treat neuropathy. The FDA approved it for seizures. And if you look on the list of side effects, it can cause neuropathy. So what the problem we run into is patients are being prescribed gabapentin, Lyrica, all these different medications, and it slowly gets worse over time. And it kills off these nerves. Once the nerve's damaged and dies off, it's really hard to bring it back, and that's when you have amputation because there's circular problems. Neuropathy is cramping, it's numbness, burning, tingling in your hands, feet. Neuropathy can even cause GI issues and circulation issues. And it's tested by different ways. It's really, Dr. Wynn that I work for, he does a 60-point neuropathy testing. So he tests many different parts of the hands, arms, legs, and so on. Traditional medicine, they do a less invasive, less number of points that they test for, sensitivity points. And neuropathy, again, can be caused by herniated discs, or we also use for treatments, we use whole body vibration exercise machine. We have infrared lighting that helps rebuild those rebuilds those vascular components, those blood vessels. It brings new ones, and it creates more blood flow, which again heals the body within. We use an Anodyne, which is like a TENS unit, but it's better technology, and it's patented technology that re-educates the nerves to learn how to function how they're supposed to. And we also throw in the components of nutrition and exercise. These are all different little things that can be put all into one to help solve a problem. Again, why isn't this being covered? It's not being covered because of the fact that there are lack of data. And in the research and talking with my coworkers, there is a site that is listed in my references on my paper that has over 277 scholarly resources for just this chiropractic care and all the data that can support the need for it to be covered by insurance. And also to show that it is successful, that it does work. It's not considered experimental. Just take one statistic, for example, the pharmaceutical industry spends $5 billion a year to treat chronic pain. 90% of those patients depend on medication. Again, chiropractors, we can help heal this pain and find the root of the problem instead of throwing medicine or Band-Aids at it. We can really fix it, and it'll get those off the streets. The cost for repair of a herniated disc, for example, is $13,000 to $21,000. If you come to a chiropractic, I know within our office, we charge anywhere from $4,000 to $7,000, and that takes care of the problem to where the patients have a huge better quality of life. That's so successful. The success rate is phenomenal. When it comes to poor documentation, the problem there is that it can be fixed. If you want insurance to reimburse it, then you have to follow the guidelines. It's simple. It's the same as any other doctor's office. If you want to have them pay for certain things, you have to have your diagnosis code, your documentation to support your diagnosis code. You have to have your procedure codes. You have to have all of these things. So again, I find it very insufficient that this is not being covered. Really, that's what it comes down to. There's a study done in 2019 that showed members who had chiropractic care coverage noted 28% lower average cost per member. That also included fewer inpatient stays, fewer MRIs, less surgeries. And again, chiropractors can also help with these shortages of physicians. If these chiropractors can help treat all of these different problems, these chronic conditions, and more, then why aren't they being covered? Obviously, in the hospitals and traditional medicine, there's not enough doctors, but we do have another option, and it's right here in front of us. Of 2021, 95% patients say it's effective. 97% of chiropractic patients are likely to see a chiropractor for back and neck pain. 89% of patients recommended chiropractors to friends and family. 88% of patients noted the quality of care was a good value for their money. So again, you know, it really can be covered. It should be covered, because what we can do here changes lives. It gives patients their lives back. And really, it should just be covered by care. Okay, so this is one of the machines that we have in our office. It's called a decompression machine. So the patients are strapped to this table around their waist here, and it is hooked up to this machine, which gently pulls the spine, allowing it to release. So any pinched nerves, there's going to be almost immediate relief with this. It also can be used for neck decompression as well. So patients who have neck pain, we have a device that can be strapped on to the table that goes around their neck, and it attaches here, and the patients will lay their heads here with their feet down at the other end. And just in our office, because we totally believe in whole body healing and wellness within, we also play natural sounds so the patients are able to meditate and fully relax and allow their bodies to heal within. The next area I'm going to show you is one of the treatment rooms. So some chiropractors use what's called a drop table. This is a drop table. So when they're doing their different adjustments, these pieces will raise, and then the chiropractor, when they adjust, they do sharp, quick movements down and allow the table to drop, and it allows the adjustments to take place. And some of these tables also have where the feet will move up and down, and this allows also the body to stretch out and help the muscles relax so the adjustments can hold. The next thing I'll show you is our traction machines. This is a full use of kinesiology. So it uses weights and pulleys to pull the spine and correct it the way that the spine is supposed to look like and supposed to be. Again, can be done multiple different ways. The strap here is the neck strap, so it can help pull the head up, back, or whichever direction that it needs. And it uses the weights for the balance. On this side here, there's two straps here. This will pull the mid and low back and hold them into place, as well as restraints for pelvic stability. Now, here's just a general description here. So this is the 3 different stages of spinal degeneration. As you can see, these lines the top one is how it's supposed to look. And we do see patients in phases 1, 2, and 3. And here you can see how the spine is supposed to be. So when someone has scoliosis, the spine is not necessarily going to be this shape. It can come out this way. It can be rotated inward or outward. And as I talked about, the herniated disc, this is the cushion here. So when this protrudes into the vertebrae, this is what causes the nerves to become upset and cause the pain and the neuropathy. In our office, in a lot of chiropractors' offices, they use physical therapy. So we do various exercises. We do have a room that's specifically built for exercises. And as I noted, also the whole body vibration. This is what a machine uses. It's a vibrating machine, and you do exercises on it. This re-educates the nerves as well as the muscles, and it allows them to heal. We also have a therapy room, so they also can use, this is a roller table, so the patients will lay on this table, and there's a roller underneath it that goes back and forth. This is used for spinal mobility. We have cold laser to help scar tissue and pain relief. There's ultrasound machine, as well as the Anodyne Rebuilder. This is a nerve rebuilder that helps relax the muscles as well. And one thing to really mention is a lot of chiropractors have the ability to take their own x-rays. So we do have our own in-house x-rays, which are a lot cheaper. And for the patient specifically, they have the ability to, with these machines not to have to pay these big prices, but they're not done for diagnostic reasons. They're done for structural. So it allows us to see just what the structure of the spine is and how we can help. Additional tools that they use, these are the tools that are used often to treat neuropathy, to test for it. We have the tuning tools, we have the wheel and the different various tools. This is just one of the many things that chiropractors use for treatments, for diagnosing, and really it just takes over just all that it can be done for the patients. There's also knee decompression, so this is similar to the table, but this is specifically for the knees as well. So I hope you guys enjoy the video and learned a lot.